I'm Brenda Lozowski. I'm a doctor of osteopathic medicine. I first felt that I wanted to become a doctor when I was about 10 years old. Actually, my best friend and neighbor died of a brain tumor. And so that perked my interest in medicine. I initially thought, oh, I want to cure cancer. But I always had compassion for people and always loved sciences and medicine. When I was in high school, I worked in a nursing home, and that furthered my desire to go into medicine, and I never wavered since. I've always wanted to be a doctor. Right after my residency, my husband and I both, he's a physician as well, moved right here to Coshocton and started our family practice here about 25 years ago, and we've been practicing here since. My favorite part about being a doctor, especially as a family physician, is the fact that I get to learn to know families and the whole spectrum of families from children. When we first moved here, I delivered babies, so I got to know the families through their babies. I knew their parents, I knew their grandparents, and I really enjoy that about family practice, is really getting to know families. I feel getting to know patients on a personal level is important. I grew up in a rural area, and Coshocton is a fairly rural area, so I see my patients all the time out in the community, everywhere we go, whether the stores, at the 4-H fair, everywhere. And so a lot of my patients actually are personal friends of mine, and they come to my home and I go to their homes. I don't see that as a problem. I know not everyone likes that, but I enjoy that. That's part of family practice to me, is to be in the community and a part of the community. And I really enjoy getting to know many of my patients on a personal level. I treat various medical conditions in our practice, do well female visits. We treat diabetes, hypertension, hyperlipidemia. Of course, any acute care, do a lot of mole biopsies. I enjoy procedures. I do some gynecological procedures as well, endometrial biopsies, colposcopies. And just the whole range. We see children, do vaccinations, sports physicals. So everything that you would expect as a family practitioner to do, I see. My husband and I live on a small farm, and we grow pretty much all of our own food that we eat, including we have several animals, laying hens, chickens. But I grew up in Indiana. My mother canned and froze all of our food. We always had a huge garden, and so I always wanted to do that as well. So I have a large vegetable garden, but I also love flowers and shrubs and anything else, but I enjoy that. I do a lot of canning and freezing of our own food in the summertime.